Okay, so here's my experience, 8:30, resting up in bed again. I just found out there's a meeting tomorrow in East, well, they call it East Midlands, UK. And I'm had a head injury, so I'm under rest. Right. So if you get let down by public servants in key subjects, I just wondered how many other disabled people are. So anything to NHS has now been outsourced. So I didn't get offered a transport before into my head, and I'm going to have to call out or up the out of hours number because I'm getting worse. So my head injury, so I need to be checked out somehow. But the problem is, there's an ambulance service is also outsourced. So the cutbacks and everywhere means I don't take my wheelchair, powered electric, so I don't get the care. And if they just charge me tonight, am I meant to go? Yeah. So then I'm seeing on this, well, my mate downloaded it, I can't. And seeing on documentation, you got all these blinking able-body people, political people I know about, don't know them per se, that making decisions about ordinary men and women who are trying to access the key services that cut back to the bone when you're stuck in shite conditions in your own home and you don't have the resources or family network support to help you out. So how do you expect to get to food bank, for example, if you get bloody your DWP benefits cut? It's going around in circles, this, right? Because I'm personally know I'm going through it all. So then you get the triggers with the NHS cutbacks in mental health too. Then the cutbacks in community services. So I've been trying to get everything I need is home-based. NHS, pharmaceutical companies, dental specialist services. Yeah, you have to meet all their tick box questionnaires, policies now. And then, hold on, I thought my mate was emailing a commissioning group, complaints department, while they didn't provide the hospital transport I need, because I need proper support. I can't do it on my own anymore. So, and then there was an email back, my mate checked on me because I'm under rest in bed and so really, really poorly. And it's saying to me that it's come from another company. And when she looked it into online, it's a company in London, not my area. So what are they doing? Outsourcing your data? Well, unless you consent, they can't lawfully share your personal data. So yet again, that's another bloody thing. Because if you haven't opted out of this national NHS Digital too, and NHS England, it's all blinking American, all this advanced system coming in. And I'm not against progress. But when they're messing about with our lives, and extremely difficult to get anything now, isn't it? Unless you've got the cash and contacts and a bit of health. But when you're complex and everything going on, well, why the hell do they think we're just a little box that can tick on a computer screen when we're not? So when the statute law like housing needs comes into it too, and you're finding that national housing companies are just profit making and don't give a shite about your situation. So where's the floating support housing needs to help you in your very vulnerable position? Well, that's gone. And then you're relying on like advocacy for adult social care, for example. And they keep saying, oh, our contract who funds us to provide that service is by the county council, so they're not independent, are they? So you find out who the head office of the company is, and they've got monopoly. So there's no longer any independent anything, because they've always got their ties now in 2018 in every bloody thing. So if it's not housing, if it's not care, what is care now anyway? And then if it's not NHS, well, what is that now with the digital system? Now, don't know what age you are, but what about the elderly? How are they going to cope when they don't know what the change is and they're not getting the right care? You're hearing about the horror stories. Well, not stories, but the real life. And I'm not that old yet, thank God. But the fact is, I'm struggling every single minute of the day, like thousands of others. So I started this channel to document my experience. And what happens the very next day I'll get a bloody head injury. Oh, I struggle, right, just to get out the bloody door, because my permanent long-term mental health is from serious crimes I've had in my life and trauma, right? So can I get any out? I lost that paperwork. So before I had my head injury, I was ringing around every Tom, Dick and Harry, saying, well, who's who and what's what? And I keep getting hanging on the bloody call. And if you don't have that call number, whatever the number might be, in your call plan, if you have a landline, then you're stuffed when your benefit cuts back as well with the DWP. So if you're relying on care and everything, where the hell are you going to get food from when you can't get into food banks and all? So if you're able-bodied, you can walk and try and see what's around, and streetwise people know what's about. But when you're in my position, there's no. So they're trying to make disabled people homeless in a wheelchair. Well, that's what's happening with me right now. I offered ages ago, right, about this housing nightmare situation I'm going through still, and the remedy and offers and breach, well, not in breach, but there's housing employees are in statute law and everything possible. There isn't any equality of human rights. There's all abuses going on. They're targeting. You just look at these websites and people, what they're doing, more than I can. And they're disabled people against cuts, save our services, you name it's going on. So there's bureaucracy in every town and city in the United Kingdom is absolutely, these people on a pedestal think they're in their tower or bloody made of gold, where they're not. I'm talking about House of Commons and the corrupt bloody croonies that don't give a shite about the ordinary man and woman. So then you get the divide. Ordinary people striving to survive in the personal situation, when they look upon the disabled people as a burden. Oh, you're disabled, now you have to work longer. So then you get the hate crimes then. I don't report it anymore, because the police ain't there to help anyone like me anymore. They're more private corporation forces rather than real honest people that gives a shite. And I have to call that 1-1 number out of hours tonight because I'm so weak and I'm really now affecting both my eyes, this head injury. So my mates here are unpaid for. I can't pay their wages and they're only being carried and struggling like hell. So the document they did a week ago, again pushing the housing company employees to accountable and saying they're going to have to pull out otherwise, and I'm left at risk. What are they going to do? Do I get anywhere? No. Last Friday, don't get me wrong, certain people mean well, but those at the top, their bosses and CEOs and all those on high wages the public purse are paying for, they ain't give a shite. So I'm no position at 10 o'clock in the morning to show my bloody face. I would have kicked up stink tomorrow if I had my health. I don't care what happens to me anymore. Because why should we be bloody quiet when they're stamping on our bloody lives? It's not our fault when we get ill and things happen to us. And God forbid if anybody out there, I see beautiful, innocent things in life being destroyed many ways. So I'm just trying to hold on with a thin piece of string, practically everything going on. So I know my personal situation and I'm trying to do things lawfully, work with people. And yet they're bloody got a tick box. You can't do this, you can't do that because there's that and the other cutbacks, you know? No. So my concussion I've got is no fault my own. This is a freak accident again. So all these letters, the medical practice and the way they work, NHS England funded, and then you find out CCGs, well, hold on, if you send a complaint, I don't want to complain, it's just, where the hell is my hospital transport? So their contract is NHS England funded. So nothing on websites, nothing for people in my position is available to comprehend. And if you get diagnosed with disability learning, there might be something about, but otherwise, no. You ain't going to find out. So this is why I'm coming to, and I'll keep it short because I really, really have to. I have to get careful of buckets of water in my own bloody flat, in my bedroom. It's so dangerous because there's a rotten floor. And it's not a proper wet room, it never has been. So they're covering their arse. They're the housing side of it all, so they won't get a liability or have to pay out of compensation for the harm that caused me. So everything I've done before got so worse for me health and ended up in hospital last year. Otherwise, I wouldn't have been in this state. It's so ill I am. So I ain't got the energy to keep going down everything I've done before, and they know that. So they're taking huge advantage of any people like me. So what you find yourself, you're in this situation where in statute law, the housing, no, what's it called now? The Care Act 2014. Well, don't get me started on that because the triggers you get are huge. And when you can't get out the bloody door in the first place, why don't they give a shite about using equality statute law and everything else that's meant to be there to protect us that's going through so much shite? Well, they won't. So my mate tries to do an email to prove the fact of what I'm going through, right, in housing to start it all off with. That's how it started it all off. And yet they ignore me and side with the housing company and their company employees, and especially my area, to make out it's all me, me, me. What a load of BS it is. Reality is they don't give a shite about people going through hell. And good people do try with their support lines, helplines. And I'm going through hell with this PIP thing. And that email has to go off saying, well, hold on. How the hell can I get to Coventry when I can't even get out my bloody door? So the main things to call out about is like my head injury right now. Because I'm really, really not well. And I've got a relative who lives in Wales, but when you have a death on top of a very close family and you're not coping with that, it's like they want you to tip over the edge. Oh, let's get rid of one disabled people, that's less one to worry about. Well, that's what's happening in reality. I ain't going that way because I ain't giving to that bloody shite system. I'll be careful. But right now, I know my head and everything else, I'm not in a fit state because of concussion. It's all in my head, the pressure, the brain, it's all, something's wrong and I need to get in hospital. And I can't, you see, because they won't. The only people that really do care, from my experience, are those that do the dog's body work and they don't pay them the right wages. And then you've got all these foreign people that bloody work in contract terms and stuff, and you don't get a proper doctor at all. Then don't get me started with people and kids have to sit on bloody trolleys in the corridor, and if you've got personal incontinence problems, right, you need the loo, you need a hoisting and stuff and equipment that you have at home. You ain't getting that on the A&E, let alone if you're stuck in a bloody corridor. And let alone if you've got communication problems like me, you can't bloody get access. Excuse me, nurse, you know? Because my dental and top, everything in my body is falling apart. Well, why can't there be a linked up service then? So a care plan where such and such is doing that, this and the other, like it used to be years ago, I remember. But no, they don't give a shite. They just want to be like, you fit in that box, that box. Well, as soon as they come in my eye, it's a mayhem. They've done it to me before. I've had so many reports over years. I can't change what's happened, but the bloody people are not being held accountable, and it's screwing up. It's screwed up. And then I've got thousands of you already going through this, perhaps. You're not even perhaps disabled. I mean, I'm seriously complex. You know, I never visualised my life to be like this. But I can't help it, you know, it's just unfortunately the way it is. So I get on with it, you know. Because at least God gives me the energy to breathe another day. I really don't know. I'm carrying on, to be honest. But I think when you have a spiritual belief, sometimes it does help. But in reality, this meeting, what my mate's reading and download, is full of BS. These so-called people that vote for this, vote for that, you're not voting for nobody that gives a shite about you. Unless your face fits, unless you're connected. It's all about who you know, it's not what you know no more. And this is just one area part of United Kingdom. But when you learn subjects, you know the real facts behind the situation, what's going on. My God, you get a target. You're just a label to them. You're just a number on their computer system. You're just a blinking number where it's like, unless you fit that box or that bit, you know, it's just unreal. I can't explain anymore. I just need to rest. I need to switch off and get cared for. The time is now to take a stand. Well, I can't stand or walk, but all the shite that's going on. And I don't know about you, but on the 4th of the 9th, 2018, I need to see what care I can get right now. But apart from that, I just come on and say, it's going to get worse before. I could never comprehend how bad it's getting until I experience it myself. Take care.